Welcome to Glow 365 on The Mia Allman Show, presented by Official Woman of Culture, right here on Caribbean Rhythms Radio. I'm Coach Lady Mia, your host. Thank you all for tuning in. You can also watch us on YouTube at Glow 365 TV shows. September is National Sickle Cell Awareness Month, and today's show is entitled Sickle Cell: Understanding the Disease and Its Impact. Today, I have the pleasure of speaking with my dear friend, who's no stranger to Glow, Miss Carla Lewis, who's an advocate and the founder and CEO of Kids Conquering Sickle Cell, who shares her knowledge and expertise in being a mother of a child with sickle cell. And that at the end of the show, we hope to give you a better understanding of what is sickle cell disease, the difference between the disease and trait, how it impacts children and their families, health complications and misconceptions, the importance of mental and physical wellness by maintaining self care regimens, and so much more. And now, here is my guest, Miss Carla Lewis, to the show. Thank you for taking time out of your busy schedule to be with us right here on the Mia Allman Show.
Thank you for having me, Mia. I appreciate you honoring Sickle Cell Awareness Month and bringing awareness. So, thank you so much for your advocacy to bring awareness to the community.
Thank you, and we're happy to have you here. You know, the last time you were here, which actually on Glow with all the other ladies, that was back in 2022 in September.
Yes, yes.
Yeah, so we're glad to have you back and, bringing awareness to sickle cell because it is a well needed conversation, not just for parents, for children, and also our community to get more involved in raising awareness with sickle cell and understanding. Carla, can you tell us a little bit about your background and the other fields of expertise?
Yes. So my field of expertise, it goes beyond, being a CEO and founder of Kids Conquering Sickle Cell. For over 13 years, I worked for hospital facility providing social services. So my background is in social services, also have a bachelor's degree and continuing education courses on grant writing, nonprofit management. So extends on to I love study with pharmaceuticals management. So I love that field particularly. Also another passion of mine. So also certification in other areas with leadership. So my expertise goes so many different ways. Been sitting on different advisory boards, even for the hospitals, and given input. So I my passion is also, getting involved, being involved in community services and giving back somehow professionally. I don't have a problem volunteers and being hands-on
Mhm.
in any capacity. So nothing's beyond me. So that's a little bit about me and my background.
And folks, when she says a little, that's a little bit. There's a whole lot that she does, but it'll take us all week to explain a lot of the stuff that she does. But we thank her for all that she does within our community, and just raising awareness on sickle cell and supporting other organizations and business as well. Now, back in 2004, you started Kids Conquering Sickle Cell as a support group at local children's hospital to provide education and resources. But it goes a little deeper and personal. Can you share?
Yeah, so yes, you're correct. Kids Conquering Sickle Cell Disease actually started in the capacity in 2004 as a support group at a local hospital. When we started, we provided social events. We supported the support group, pretty much did visits to children in the hospital, being a resource to the community of those impacted by sickle cell and other hemoglobin disorders. We also wanted to be a resource to our health professionals. What we realized was that there was a lack in the community. So I had a son that was diagnosed with sickle cell disease. He was newborn at the time. The newborn screening picked up an abnormality, and he was diagnosed later, a couple months later, after verification visits, taking continuous tests, being able to be verified, diagnosed having sickle cell disease. His is a little bit different. So he has a two components, so sickle cell disease and beta thalassemia. So those two, it just gives another origin of sickle cell because there are many, many. I want to say we call them hemoglobin, our hemoglobin disorders coming together, right, as families that they form this sickle cell family. They're all in the sickle cell family. So that's particularly what he was diagnosed with. So my son, realizing that I was asking the doctor, at the time, what resources, let me meet families. And he was like, families. He's like, we don't have, such a capacity that you can meet with others' families. We do have a clinic day that most patients do, are they're scheduled to come in each month on a particular day. And then I said, what resources and trainings do you go to? And he said, well, we don't go to too many trainings because of the funding. There's a lack of funding that for health professionals to go out. And I said, man, boy, something has to change. And instantly, when I thought of a couple of things and started to do some research and see what was in other states, I realized that there were resources in other states that were doing education, and it was developing different resources for families. So particularly for me, I was a mom that was desperate for services for my child because I wanted him to have the best care possible. I wanted to make sure I know everything that there was about sickle cell in order for me to educate him and also educate myself so he can have the best care possible. And so I did that. And I didn't want to say take the knowledge only for myself, but I wanted to make sure my community has this knowledge. And so there was the birth of the support group in 2004. And then we launched on to having a nonprofit 501c3 nonprofit organization in 2014. And this year, we're actually about to be 10 years old as a nonprofit organization. So we're pretty proud and we're celebrating that this year.
Again, congratulations, and thank you again for doing so much within this community and sharing a little bit about yourself, and also that transparency of being a mother, was diagnosed with sickle cell, and being a mother and having a child that has any kind of chronic illness, it does take a toll, but we get through it and we draw strength from that. And same thing, what you're doing is raising awareness and letting other mothers know that you know we can do this. you know we can keep going and support our children, and then they're not alone in this fight. Carla, give us a breakdown, a better understanding on what is sickle cell disease and what is the difference between the disease and the trait.
Sure. Thank you so much for these questions, to bring awareness and just give a lot of information about sickle cell. When I mentioned before, we started as a support group. We also noticed that there was a need for not only children, but there was a need for families on a whole to get information. We at the support group, we had adults that showed up with their families, just wanting more information, and this helped us to know that there was a need in the community. So, what is sickle cell? So, sickle cell, there's an impact of sickle cell first. So, about 100, we have over 100 babies born with sickle cell each year. for sickle cell disease, and they said there's about 100,000 people living in the United States with sickle cell disease. We know that they're estimating from 70,000 to 100,000, but the data is not a little, but it is very outdated. About when my son was born, 2022, when I was doing research, 2000, sorry, not 2022, 2002, and when I was doing more research in 2004, this was the same data. So we know there's outdated data that we know that there are more people living in the United States living with sickle cell disease. So the impact is definitely there. There's definitely about 3 million and possibly more with sickle cell trait. And this is reported data from the Sickle Cell Disease Association of America, which is also getting information from the CDC, the Center for Disease Control. So, and there's about 1 in every 16,300 Hispanic babies born with sickle cell disease, and that's within the US. Sickle cell disease. So sickle cell disease is an inherited disorder of red blood cells that causes the cells to become a sickled abnormal shape. The cells are firm instead of round and flexible. These cells are hard. If you look at the picture, the cell is pretty much formed like a half moon, and that one, if you see that the half moon shape makes it very difficult to pass through the vessels. So normal cells lives about 120 days. Having sickle cells, the sickle cells live from 10 to 15 days. So we see that they pretty much die off a little bit faster, which the body is working hard. What does the red blood cells do? So the red blood cells actually transport oxygen to every part of the body. So we know we need oxygen to live and survive. So imagine that these hard sickle cells getting clumped up and getting stuck in the veins. This is what's causing complications. So the normal cells are a little bit different. They're soft, they're easy to flow, they flow nicely through the veins because they can transport the oxygen. Whereas a sickle cell having many, they pretty much make things a little bit complicated. They get trapped in areas and have trouble transporting oxygen. So that is that's the main issue of sickle cell disease, because it's having difficulty depriving organs and different vessels of passing oxygen, being able to transport that oxygen. Then what happens? So these areas are lacking oxygen, needed oxygen, and then causing other complications. And I'll go through some of those complications. So sickle cell disease versus sickle cell trait. So someone with sickle cell trait, they pass on the gene. So one parent will have a normal gene, one parent will have a sickle gene. So one normal gene and one sickle gene. Another parent will also pass a normal gene and a sickle gene. So we know that with two parents passing two abnormal genes, that would be the child over with the colored in blue, that child will have sickle cell disease. When one parent passes on an abnormal gene and the other one passes on a normal gene, then that child will have sickle cell trait. There's also a possibility for two parents that have the trait to pass on two normal genes. So if they pass on two normal genes, that child will only have nothing, only be pretty much a normal child, have no trait, no sickle cell disease, and will be considered basically a non-carrier for the disease or the trait. So it's a little bit different when a parent, so it's very important for parents, first of all, to get tested to know their status if they have sickle cell trait. And it's very important for those that do know they have the trait to definitely talk to their partners when they're considering, family planning. is very important because there's a possibility if two parents have the trait, there's a 50% chance that they can have a child with the trait and a 25% chance that they can have a child with the disease and a 25% chance that they can have a child pretty much with no disease or which no disease or trait. And it's very important that they know. And this is the possibility with each pregnancy. So really with having the sickle cell trait, they really experience any pain crisis, but for overexertion can cause sickling. So they can have some pain and the blood cells can get trapped. The difference is they will have more normal cells than sickle cells. So that will be what those with the trait will have. So those with disease have a high percentage of sickled cells, which is the disease, which causes the complication. But the sickle cell trait is carrying an abnormal gene. So they do produce some sickle cells. They don't produce as much as a person with sickle cell disease. So that is part of the difference. So being careful of overexertion have been one of the things that studies have come a long way on with those that have the trait, that it causes sickling with overexertion. Those playing, sports is very crucial that they're aware of the trait status and takes breaks, being able to drink water. That means gets very hydrated, to be able to be very much careful with their health when they are exercising so they don't have overexertion, because it have been known to be fatal with some of our those athletes that have been playing sports or doing I want to say training in advance. So I want to say being protected of those also that's in the military, right? Because they're also active in doing exercises, and it's easy to be, out early and get overexerted. So even the military is very much cautioned with their enrollees that have the sickle cell trait. And there's another study that have been done, which RMC. So renal medullary carcinoma has been much known to be connected with sickle cell trait and having a particular kidney cancer. So it's important to talk more about discussions of noticing, talking more with the doctors and being seen on a regular, having regular checkups for those that do have the trait. So those are the two differences with sickle cell disease and sickle cell trait. Complications of sickle cell disease. So going into much complications, when I spoke about the cells sickling and there's different, and you saw that in that picture that they were getting, they couldn't be transport the oxygen as well. So this causes anemia. It has also been reported to cause mild to severe pain. Actually, pain is one of the hallmarks of sickle cell disease, one of the major complaints. Also, stroke, blindness, gallstones, receptive to infections, acute chest syndrome, which is pretty much like related to pneumonia. And it's one of the leading cause of death for those living with sickle cell that have that particular complication. So it's taken seriously when those with sickle cell come into the emergency room. Organ damage. Remember, I spoke about oxygen being transporting, and when it has that difficulty, those organs are being deprived of oxygen. So slow damage is always occurring in those that are living with the disease, because there's the complication of transporting oxygen to organs. Pulmonary hypertension also have to do with the lungs, skin ulcers, because when we think about all organs of the body from head to toe, right, that this disease is impacting. Priapism in males, which is an abnormal erection, not sexually produced. And this is caused by not the oxygen not flowing as regularly. And this priapism is another complications that males do experience. And sometimes it takes medical professions that are well known to this to be able to um, take some measures in order. Sometimes surgery is necessary for those that have priapism issues. Other serious health complications, problems we have to say with health altogether, and short lifespan has been associated with sickle cell disease. And I'll go into that a little bit more. So there's no universal cure for sickle cell. Study shows positive progressions with bone marrow transplants, which we are so lucky to have as a curative therapy. So they have come a long way with doing full match bone marrow transplants and half match. What does that mean? A member of the family has a match that will have, they call it HLAs, that they have a combination that is pretty much similar to the other person's having two parents with sickle cell. Usually it's a sibling. And that match will pretty much be the 100% match for a bone marrow transplant. And there's about 25% of people that will have a full match. So also they're doing half match, which one parent or maybe one child that pretty much matches very closely with the child. So that is one of the treatments. And it is different because there are requirements and eligibilities that families must reach be order to be qualified for this. So, and there are potential risks. One of the potential risks is also rejection. So rejection can lead to other complications and sometimes even mortality. And so there are now more medications to help with complications of rejection. So that is helpful. Studies have shown progression with gene therapy. So gene therapy, editing one's own cells, and being able to be able to infuse that, take it out, and then infuse that back into their bodies. And that is, they also have to meet special requirements in order to be in a clinical trial, because clinical trials is also, major studies that's going on. So there are only 4 FDA approved medications to help decrease the sicklings of cells, and they all have different components of how they work. Just like any medication, some may work for some people and some may not work for other people. So not everybody can take these medications, and sometimes a reaction causes one not to be able to take a medication. But now we do, after 20 years, in 2017, we had one medication come out, which is L-glutamate medication, and then we had 2 others come out in 2019. So now we have 4 medications that are out to help those that have issues with sickle cell disease as a complication. Studies show lifespan average is 40 years old. Remember, I told you lifespan decrease. But we know that patients have been living longer and beating the odds of what statistics may report. We do have some patients that are living longer and beating the odds because treatments have been effective, and lifestyle changes have been effective to help. Next slide. So who does sickle cell affect? So sickle cell affects millions of people. This map shows that there are areas that are most affected by sickle cell. So we have seen, we know that sickle cell disease affects those from African American descents and Hispanic Americans, and those from Central and South America descendants of the Middle East and Asia, Indian and the Mediterranean area. So all there, that Caribbean area also, we know pretty much these are the research populations that have been reported to have more impact on that because of migration changes. We know that changes within who it has affected the most, this population is stand out because of research. And this is all reported from CDC. Next. So every hospital visit and feels like taking home a newborn baby for a mom. Also, for those that are walking the life living with sickle cell, these adults, it is like winning the battle when they walk out of a hospital. Imagine going in with excruciating pain and having to live a life of in and out the hospital at times, and frequent medical visits. We call it comprehensive care that's also needed for those that are living with sickle cell disease. That means seeing many specialists. Like I showed, it's affecting so many different organs. So seeing a heart doctor, seeing a pulmonary specialist, seeing the eye doctor, because I don't know if I remember, the complication of the eyes is also one of the factors that involves sickle cell complications. So that is actually very common. So they also have to see an eye doctor. So comprehensive care is needed. And when you have a child with a chronic illness, or when a warrior, we call them, when a warrior is facing challenges, it is so important to feel the needed and feel supported, because the journey is not even. So winning the battle of coming out the hospital feels to a mom like bringing home a newborn baby, and feels to a warrior like just being able to overcome one another challenge. As a mom, I appreciate a team of healthcare providers because I know they care and value us. So we look for healthcare providers that value us. Now, the pediatric side is so much different from the adult side, and I'll talk about that. There's some issues there. Next slide. So this is my number and my information, the website, my email, and the website for Kids Conquering Sickle Cell. When I spoke about challenges that sometimes warriors face, and I'm going to go into those questions, sometimes the misconceptions. We'll talk about misconceptions a little bit later. But when I talk about challenges warriors face, it's so different from pediatrics. So we will get into that a little bit later.
Wow, Carla, you said a mouthful. I'm still trying to process all what you just said. And, looking at the slides again, folks, I know you're listening on Caribbean Rhythms Radio, but you can go to the YouTube channel at Glow 365 TV shows and actually see the visual of this show here as she breaks everything down, so that you understand what she's actually talking about, on sickle cell, and also the trait as well. I want to ask one question, as you are talking, what is the percentage of a child being diagnosed at birth, or what age do parents normally see a difference in their child that something is wrong?
Okay, so here in the United States and other states, we have almost all of the states do the newborn screening. So the newborn screening test typically picks up if the child has sickle cell trait or sickle cell disease. So usually with the newborn screening, then when it's reported, they follow up with the parents to notify them that the child has an abnormal testing. Then they have to come in for a second screening to make sure to confirm the percentage of what they saw with the enamel cells. So within 3 months, typically with the newborn screening, they can tell them where they saw sickle cells. But in 3 months, though, families may see a change within the child, just like just a normal child has fetal hemoglobin. Those warriors with sickle cell has fetal hemoglobin that protects them, that's from their mom. So typically that fetal hemoglobin starts to decrease by 3 months old. So normal cells are oxygenated. Fetal hemoglobin cells are those normal cells that are also oxygenated. So at 3 months old, fetal hemoglobin start to decrease for those that are living, sorry, for those that are living with sickle cell disease and those that are living with normal, nothing. They start to decrease at 3 months old. So those living with sickle cell, unfortunately, some with will start to feel complications if that fetal hemoglobin is not as high. And they will start to have sometimes what we call a sickle cell crisis, which is pain in any area of the body. That sickle cell crisis tends to happen in the hands for babies. So,
Mhm.
swollen hands and swollen feet, they call it hand and foot syndrome. So, hand and foot syndrome is one of those complications of having pain crisis with the oxygen not being able to be transported. Luckily for those that live with sickle cell disease, they have something uncommon that sometimes definitely happen to a lot of people. So what happens is with those with sickle cell disease tend to hold on to that fetal hemoglobin even through adulthood. And that fetal hemoglobin is some nice oxygenated cells that can help them. And with having that fetal hemoglobin, nice oxygenated cells, these cells will help prevent having pain crisis, and that can pretty much be more helpful to the parents also, knowing that during the age of 3 that that fetal hemoglobin is kind of disappearing or might stay, and then moving on from that. So knowing that during that time that they have that support to know fetal hemoglobin is very important, and now we have medications to hold on and bring up that fetal hemoglobin. So their medications now being directly impacting those cells. So that have been helpful. So to answer your question, yes, at the age of 3 months, that's when the decline pretty much of having the fetal hemoglobin that will kind of predict more our impact of the disease coming on.
Wow. Thank you for sharing that. What are some of the common misconceptions in regards to sickle cell?
So some of the common misperceptions of sickle cell disease is that our warriors are drug addicts. So unfortunately, because a lot of warriors need narcotics as a treatment form of the pain. Sometimes the pain tolerance imagine a child from 6 months on having to get treatment from narcotics. You start to build up a tolerance. So as young as 3 years old, some of these patients can have, you know, some kind of pain treatment. And when they are even, young, they're getting some form of pain treatment, and the tolerance having, medications all the way up until adulthood, it's different. And they may need the strength of a medication that may, for me and you, might be different than someone with sickle cell because they've built up a tolerance of taking years, not even taking, but needing years of treatment of these medications in order to survive and thrive some really intense pain. So, not like to describe what the pain may feel like. Someone told me once when I asked what does the pain may feel like, they said, picture someone hitting you with a hammer over and over and over at the highest tolerance and highest
Mm,
height that they can continue to hit you
wow.
in one spot. And that's what somebody described to me. Then another person described to me, said, you remember if you ever had a burn on your hand, on your skin, that
Mm,
something burned you? Think of that feeling inside of your vein, and you cannot stop. You cannot put water. There's nothing you can do to soothe that at the highest tolerance of getting a burn. and feeling the after pain. So when we think about the level of pain, and sometimes, pain is rated from 1 to 10, that's only on a scale. These patients are feeling irrational pain that cannot even be described, but they've known this pain even from birth, being a newborn, because remember I said from sometimes 3 years old. So from being so young all the way up until adulthood. Now they're finding different ways to be able to treat pain, which is great. So we have medical marijuana that is also being used to treat pain. There are different things of using meditation, as well as using herbs. So there's different forms and different things, holistic approach in order to treat pain. You know, there's so many ways of doing some research and and exploring. So because patients don't want to be on pain medications, but that have been the form of treatment and one of the regimens of treatments that's actually needed for some patients. So the misconception is definitely, they want to go to the hospital. No one wants to be in the hospital. No one wants to be on pain medications. There are a lot of patients that have explained that. Also, having chronic fatigue impacts those living with sickle cell. So imagine you at your lowest and having to go to the hospital and someone mistreating you. And remember when I spoke about treatments that are care that's different for pediatric care from adult care. So a pediatric care, the focus is to help the child get out of pain. In adult care, it's not always like that. They're expected to know their disease. If they know what medicine works for them and can help them tolerate this pain and get them to a functioning state, there's sometimes look at maybe being addicted or being pains, attention seeking. So it's kind of different looked on when you're an adult, being looked at when you're adult than when you're a child. Treat the pain when you're a child. Let's see what exactly do they want when they're adult. And sometimes that focus and that treatment impacts the patient getting the right treatment and getting the pain down to be tolerant that they can function at home.
Wow, I can definitely relate when it comes to that pain because, a condition I have is, lymphedema, cellulitis. And, some people ask me, what does that pain feel like? And I said, just picture somebody pouring gasoline on your hand and lighting a match. I
Wow.
said, that's pain, you know. When you go to the hospital and get treated, and they say, what is your pain level? And I said, 10,000.
Yes.
Because
Remember we spoke
it's
about beyond
painful. It's
10.
like you can literally, take your hand like this, and you can feel the heat coming off of my arm, you know. So, yeah, I can relate to that pain and to constantly suffer with that all the time, the joints, everything. It's difficult. And I know that probably plays a lot on their mental wellness as well, those
Yes.
challenges. So
Yes.
my hat goes off to them, that the ones that just keep pushing through and bearing through the pain and the constant, going in the hospital. Because I mean, it's ongoing. I know what it's like because the lymphodemas are
Yes.
like, this is ongoing. It's not going away. There's no treatment for it. We find ways to cope and minimize, you know, but it's a part of our lifestyle, and um, we got to do what we got to do
Yes.
with that. But how is the impact on sickle cell on individuals, especially families? You know,
So
um,
so Yes. When you spoke about, sometimes it's ongoing for families and going in and out of the hospital, we spoke about comprehensive care, um, being able to see, many specialists and doctors, and making um, that is the lifestyle. That is your lifestyle of caring for a child with a chronic illness. That's the lifestyle of someone living with the disease. So, because we have to think about young adults, young adults that are thinking about their future, planning for their future. How does it impact them? And it impacts them on it's just making sure you plan accordingly, making sure that child have different things in place when going to school. We talk about having a 504 plan, which is provides accommodations for a child that's in school and letting them understand they have a chronic disease, and the importance of them taking water breaks and the not going out in the heat. So there are things that prompt more sickle cell crisis. So I didn't speak more about that. So heat prompts crisis. The cold, extreme cold prompts crisis. Exertion, definitely. That physical, overexertion definitely can cause a crisis. Simple things like going, swimming, going in the pool, that can cause someone with a sickle cell crisis. There are things that they have to be careful of, that we
Mm-hmm.
may take for granted as a person that can do these things without harm, that may cause them a pain crisis and then impacting them. So when we think about pain, we're thinking about two things. And what I like to bring to attention, that it's not only the pain. We got to understand what's physically happening behind that.
Yeah.
There's cells being deprived, being that's trying to transport oxygen, that's depriving organs of having the right oxygen, so enough oxygen. So when we think about the physical and also what is happening, the state of emergency that's happening in the body, we want to be able to prevent these pain crises as much as possible, these major pain crises. So being able to know what can trigger your crisis. And
Mm-hmm.
sometimes there's nothing that can trigger it, that it's just a waking up in the morning. My son was getting pain crisis when he woke up early in the morning. They would wake him up. It's not that he wanted to wake up, but the pain would wake him up, because this is a day that having this disorder, it just causes this complication of cells having difficulty passing oxygen. That pain could happen anywhere. His pain was a lot of times in his lower back. I remember one time we went to the hospital, it started in the lower back, then in the right arm, then in the left arm, then in the right leg, and then in the chest. So we had
Yeah.
all kinds of issues going on, progressing. It started to progress. So from not having enough oxygen in one area progressing to the other, some patients will say, I have it all over my body. So being able to understand that. And some patients, when I spoke about pulmonary hypertension impacting the lungs, some patients needing oxygen. I know my son at the age of 9 had a very bad crisis. He needed oxygen. We had an oxygen tank. They brung in everything, special equipment, being able to see a pulmonary specialist, so the impact to families goes a long way. Being able to balance time. Those families have to juggle work. How you be able to hold a
Mm-hmm.
job, especially if your child is very sick. Those with worries that are able to work, how can you hold a job, managing your sickle cell crisis and being able to function as a normal person as you can. And that's where we know that much more medications are needed. We have 4 FDA approved medications. We have curative therapies that are, in place, and we need more research. And when we talk about research, I'm saying we also need funding support for sickle cell, being able to capture data not only in certain places. We needed to capture it in the major places that have a high prevalence of sickle cell. Florida is one of the number one states that have the highest prevalence of sickle cell disease. Let me repeat that again. Florida
Yeah.
is one of the states that have one of the highest prevalence of sickle cell disease. So, a
Wow.
highest number of people living with sickle cell disease, but yet
Mhm.
we're not we're not chosen for surveillance, that they can continue to surveillance and have the right research data on how many patients are living with sickle cell and how many patients are being born with sickle cell on a continuum. So we know from research and data they were able to pull that out
Mhm.
in the past, but we know that ongoing surveillance and data is needed, because that means we have the trait prevalence here. We do have those living with sickle cell, and those that live with sickle cell disease. When a warrior lives with sickle cell disease, when they are with a person that doesn't have sickle cell disease, that's a non-sickle person with that have no sickle cell, person with no
Mhm.
traits whatsoever. No matter if they produce a child, they will produce a child with sickle cell disease, because a person with sickle cell disease has two abnormal genes. They can only pass down one. So they will pass down one abnormal gene. So their child will be born with the trait. So there's no getting around that. They just have to make sure that their partner does not have sickle cell disease or sickle cell trait, in order not to have the chances to produce a child with the trait or disease status. Sorry, the disease status, because they will produce a child with a trait. So the disease status. So we have to recognize that there's burden to the families that have to battle this disease, just like any
Mhm.
disease, chronic disease. But those families have the challenges because, sometimes children,
Mhm.
and it's known. Remember, I tell you, it infects the brain. Children
Yeah.
sometimes have stroke. Um, and what do you do? The treatment for stroke for those living with sickle cell disease is typically have a blood exchange or blood transfusion. They more do exchange. So monthly, in order to reduce the chances of having another stroke. So blood donors, we thank you. We thank you, thank you, thank you. Giving blood and seeing those big red buses and other entities that are around the state that do blood donations, collections. We hats off to you, because without that, it would be impossible to expand the lifespans of those living with this challenging blood disease.
Wow. Man, that's a lot. And I know we've talked a couple of times, and I know sometimes your bags are always packed because you may have to go to the hospital. So yeah, I understand because sometimes my bags are always packed because when that time comes and it flares up, you gotta go. You gotta be prepared at.
You mentioned one important thing, having those bags packed. So I was having my bags packed, and after a while, my son would tell me that. I was like, "Okay, so what you want to put in your bag?" He's like, I'm not staying, so I don't need my bag packed." And I'm like, "Oh, okay." This time my bag is packed, right? And then we go in, and then of course he's disappointed because it's usually always a
Yes,
stay.
yes, they,
Like
yeah.
I know this,
Mhm,
but after you get older, he's like, maybe not, being hopeful.
mhm.
So, what has been a blessing, when I spoke about curative therapies, my son has actually had access to having 100% donor of his little brother. In March of
Wow.
2023 of this year, he had a bone marrow transplant, and it has been successful. He is 6 months post
Woo-hoo.
transplant. Yes,
Yes,
he will
yes.
continue to be under care of his physicians for one
Mhm,
year, but we're 6 months in, and he's doing very well. He's still at the stages where you still have to stay indoors, be very cautious of
mhm.
anything, because chemo was part of the
Yeah,
process, wiping out the immune system.
yeah.
So he's in need of his vaccinations all over again. It's not time to get them yet, so he's still in hibernation, keeping careful, and but doing
Mhm.
well. So we know this is part of the treatment,
Yeah.
that continuing to go to many doctors visits and taking a lot of medications. but staying safe is priority. So
Yes.
his time in the home, we just try to make it as I want to say eventful as possible. So family times when you can. He's FaceTime with friends. He does have social time where he goes outside, but he has to minimize to, friends and crowds and all that stuff. He picks up food in the drive by and just kind of orders and picks it up. We don't want to, risk being around others because of the,
Yeah.
being cautious of his immune system right now. But it
Mhm.
has been a blessing. So when I talk about research and curative therapies, I am so one for more research, curative therapies, and being an advocate for definitely legislative funding going towards helping those that need it most, and that is putting towards research and putting towards a cure for sickle cell disease, because that's what we need, cure and treatments, more treatments for now.
Yes.
But we want to see that universal cure come forward. So I'm lucky that my son have been able to take advantage of curative therapy, which is bone marrow transplant.
Awesome. Awesome. Now, what are some of the self-care regimens that you do on a regular basis that could also be beneficial to other parents with children with sickle cell?
So I would say rest without guilt. And that is not only for parents, that is also for those warriors that are fighting this disease. Sickle cell causes fatigue, and sometimes it's associated with one being lazy. But no, rest without guilt. The times that those warriors are in pain, it's a challenging time. The times when parents are going to the hospital, sleeping, then going to work. I was one of those parents and going from work, right from the hospital, and going right back to the hospital after work and doing it all over again the next day. And my boss didn't even know that my second home was the hospital. We had a bath, we had everything we needed, those bags as packed. That was
Yeah.
our second home. So rest without guilt, being able to spend time with family, being able to, I would say that my saving grace was also my church. Being able to have a faith-based home in order for my mental health and spending time with God, spending time in my word, was something that helped me. Meditation, going for walks, being able to enjoy that self care time alone. Early in the morning, I would go for walks right around my area, because it was that important for me to just feel the air of having time to myself and do something that I can enjoy, listen to just the words, sometimes just the birds, being able to enjoy that time, and reflecting, being able to talk to a professional, healthcare professional, is one thing, but being able to talk to a mental health professional for those that are
Yes.
living with sickle cell disease and parents that are experiencing challenges is so important also. There's a financial burden that also comes with caring with the chronic disease. Some not able to work, some parents have to have less of an income in order to care for their child. Those that warriors that can't, have a full-time job, which impacts insurance, which impacts so much. That all affects one that wants to live to their highest potential, right? So we know that getting a mental health professional on board as part of your team is so important. I'll also say reflecting, taking time to reflect on the positive accomplishments, taking time for that meditation, reflecting on the achievements that you have done. Sickle cell can be a part of your life, but it doesn't have to be your life. So it's a disease and it impacts one, but we know that without faith, without the things that you take it to your highest
Mhm.
power, you have control. So that positive mindset is definitely, think of the things that you have accomplished. I think back on the things that I've accomplished. I accomplished going to school. I accomplished getting my child the best hospital, head hospital care professionals on board, even when we went in, building those relationships. When I said that was our other home, that meant I had family there. So when I went in, they would say, hey, Miss Carla, and whatever you need, what can I do for you? And simple things that's not like was I didn't notice one day I was sitting in the hospital one day and it was like it was maybe near 2 or 3 o'clock, and he said, "Did you get it? Have anything to eat?" And I thought to myself, here I am reminding my son for breakfast, lunch, and dinner each day, every day,
I
and this
forgot
person
about
asked
you.
me, "Did I eat?" And I was like, "Oh my gosh, I didn't eat breakfast. I didn't eat lunch." My mindset was pretty much on making sure
Focused on
he
him.
was well, and I wasn't caring for myself. They came and brought me some little snacks and was like, and I was like, I have to remember that now is my time. I have to eat something because I'm no good if I'm here helping to support him and I'm not. So taking the time to make sure you nourish your body with the things that it needs. So that it needs rest. It needs food. Sometimes you may even need to talk to a friend. So sometimes you
Yes.
don't may not have that family member that is so supportive. I can't tell you times that people said to me, "He's in the hospital again." Well, that doesn't feel good to me as a mom that you
Yeah.
don't have the battle that I have. So people may not
Yeah.
understand, but there will be definitely a friend or someone with a similar journey that will understand and be able to say to you, you know what, it's gonna be all right. And those words can be so helpful. So thinking on the positive that even taking the time for yourself will do. I can go on, so I'll just stop there.
Thank you so much, Carla. And wow, that was a lot of vital information you just share, and also, your experience of, taking care of a child with sickle cell. Again, when our children go through it, we also go through it as a family. So we just got to stay positive and be educated. You got to educate. But again, the outside, they don't know what we go through as parents when you're coping with a child, with a chronic illness, and it's a lot. So we need that support from our community, from our church, and again, as you said, talking to a therapist, just to stay in that mental wellness space. For the folks, can you share before we go where they can get in contact with you and if they'd like to support and be involved with your kids conquering sickle cell?
Yes. So with Kids Conquering Sickle Cell Disease, we focus on education, awareness, and outreach. So we're here based in Orlando, Florida, but we have a reach all over nationally. We also have a program in Jamaica called our One Love program where we go visit Jamaica annually, and we give things. We give a support health kit, sometimes always sending food, being able to provide things like a backpack that they can carry when they go to the hospital that will have a blanket because they usually have to carry their own sheets, being able to have a thermometer when they're sick. They need to take their temperature. That's one of the least things that could show a sign of some kind of infection is taking their temperature. So we want our warriors to have those kits that have that, and just simple things like having a heating pad for when they have pain. So all these things are in the kit that we also provide when we go to Jamaica, West Indies. And so if you want to be a part of Kids Conquering Sickle Cell, whether volunteering or either giving financial donations, you can always contact me at clewis@kidsconqueringscd.org. You can visit our website, and there's so much to learn about sickle cell disease and sickle cell trait. We have tons of programs that focus on education, where we have an annual conference also have educating about sickle cell. We have a program dedicated to our young warriors in transition. So you can visit our website at www.kidsconqueringscd.org. And you can always feel free to contact us and look up information to know more and share more about sickle cell.
Thank you so much, Carla Lewis, for sharing again all this vital information. And for folks, please reach out to her and support her foundation, so that we can help, our children, help the families that are going through or diagnosed with sickle cell. Again, I want to thank my special guest, Ms. Carla Lewis, who is a founder and CEO of Kids Conquering Sickle Cell, who gave us a better understanding of the importance of continue raising awareness and what is sickle cell. And until next time, continue to find your power of glow that equals our greater of wellness within the mind, body, and soul. And don't forget to join us next Thursday for the Mia Allman Show again. I'm talking on a topic that is very personal and passionate to me, entitled Breast Cancer is a Diagnosis. It's not who I am. We're going to raise awareness. We're going to talk to some invited friends that are doctors that are going to share so much vital information on breast cancer awareness. So, again, next week, Thursday, 7 o'clock Eastern Time, right here on Caribbean Rhythms Radio.